Let's bring in ABC News medical contributor Dr. Alok Patel to talk a little bit more about this. Dr. Patel, thanks for being here. You heard Cecilia there. Something like 72 cases now potentially linked to this Washington Gridiron dinner. So it looks increasingly like a super spreader event. But everyone who attended had to be vaccinated. So is this just a risk that we have to accept if we want to return to unmasked social events, or is there more we can do?
Well, good morning, Diane. You know, this is a risk that we unfortunately have to assume if we're going to have events like this, but you can still mitigate and turn down the risk by focusing on those basic things that we've done all along, like ventilation, masks, and maybe proof of a negative test, because the 700 number of people going there and all these cases turns positive, that is not necessarily counting those people who aren't getting tested regularly, such as the staff working there as well. So we have to consider the entire community, not just those who have access to elite healthcare and daily testing.
And Dr. Patel, House Speaker Nancy Pelosi, she spent time with President Biden and Vice President Harris last week, and then she tested positive on Thursday. Later that very day, the Vice President presided over the Senate without a mask, and a maskless President Biden met with Judge Jackson. Was that risky? What's the latest CDC guidance on when you need to mask?
Well, if we actually look at that behavior, that is risky. And I think it's really important that the White House realizes that they're setting a precedent to the rest of the American people about wearing a mask to reduce your risk, especially because they're in DC that is seeing a surge of Omicron BA.2. Now, the CDC guidance is really only based along community transmission plus hospital capacity in certain cities. But if you look at community transmission, something around 20% of this country has low transmission. And so it's a little complicated. And the CDC guidance is almost saying, hey, let's wait until we have a problem, hospitalizations rising, before we mask. We may need to revisit that and advise people to mask sooner if they're in a surge, if they're indoors.
And an Omicron variant, BA.2, has led to a rise in cases in Europe. It's now the dominant variant in the U.S. as well. And we're typically a few weeks behind Europe when it comes to things like rise in cases, rise in hospitalizations, et cetera. So how concerned should we be about this right now?
I think we should definitely be keeping our eyes open right now. And I think the next 2 to 3 weeks are going to be very telling. As Omicron BA.2 is passing that 70% mark in terms of infections here, we're potentially going to see hospitalizations trail that. And Diana, remember, we see 30,000 or so cases per day. That's a severe undercount because of how many cases are not being caught or home tests right now that are not being reported. Now, you look at wastewater surveillance, that's going up, but that doesn't necessarily reflect a rise in the cases. So we just have to keep all of our eyes open and realize that when we talk about the new normal and not being afraid of COVID, that is not taking into account the about 10 million people who are immunocompromised, children under 5 who are not yet eligible for vaccines, or a lot of people out there who don't have the baseline protection.
And the CDC has authorized a second booster for older people, those over 65 or over 50 in some cases, but nearly a third of people over 65 have not gotten their first booster. So how protected are you at this point if you're fully vaccinated but not boosted at all?
You saw my frustration hands when you said that only a third of people above 65 are boosted, because that is something that we need to fix right now. Now, if you are one of the people who just got 2 shots, you are still considered to be fully vaccinated, that's approaching 70% of Americans. Our data suggests that that's still a high amount of protection against severe illness or hospitalization, but the protection against symptomatic illness, which can still cause a quality of life issue, can cause long COVID, or can cause you to spread it to somebody else, that's waning. After 3 shots during the Omicron wave, that was a really high level of protection. But again, after 4 to 6 months, the antibody protection does wane. So everyone out there needs to do what they can to assess their own individual risk. And please, if you know someone who hasn't even gotten vaccinated or their 3rd shot, talk to them about it, because there's still a lot of virus in the community.
All right, Dr. Patel, always great to have you. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.